Before we even discuss addiction, let's talk about the DSM. It's the clinical guide used by doctors, psychologists, and researchers to study and diagnose mental health conditions. It documents patterns that show up consistently in the brain and behavior. So when addiction is classified in the DSM, it's not to remove accountability. Responsibility and choice still exist. That part is true. The reason it's classified is because the disorder begins before the drug is picked up. Genetics, trauma, early stress, impulse control differences, reward sensitivities. Those things exist long before the first drug. The substance doesn't create the disorder, it exposes it. That is the exact reason why not everyone who uses becomes addicted. Two people can make the same choice, same substance, only one loses control. The DSM classifies addiction on what happens next. Loss of control, impulsive use, tolerance, withdrawal, continued use despite harm. Those are clinical markers, not opinions, not excuses. Accountability still exists, harm still exists. But classification is how the brain functions once the disorder is active, not if someone is a good or bad person. Just like diabetes or cancer, certain behaviors can increase risk, but risk is not the same as blame. That's why it's classified as a disorder. Not to excuse behavior, but because the diagnostic criteria is measurable, repeatable, and clinical.